Hello there. I'm Sammy Canner. I'm the pharmacy intern here. I heard you might have a couple questions about your new medication.
Yes, I do. Thank you.
Can I verify your name real quick?
Sure, my name is Patty Haffa.
Oh, okay. So we understand that you have a new medication here with us. If it's okay with you, that we would like to talk about how to take it, and just some reactions that might come with it. It would only take a couple minutes if that suits you.
Sure, that would be great. Thank you.
Okay. So did your doctor ever tell you what this medication was for? Or?
Well, I went to the doctor's after I had a panic attack and my blood pressure went up, and he put me on this drug to control I think the panic attack. So also therefore would control my blood pressure.
So that is a common usage for this drug. The common usage is usually depression, anxiety, or for panic attacks in your case. So that's primarily why they prescribed you this drug, and which the drug that you are taking is known as sertraline, or you might have heard the brand name of Zoloft, but that's a different name. But just so you're aware of what this medication might look like, to you. This medication usually is 25 milligrams initially, which is around about half a pill of what we are giving you, which is 50 milligrams. You should take about 25 milligrams or half a pill initially for the first couple of days, and then we'll work our way up into a full pill or 50 milligrams. And this is mainly because this drug is very reactive in many patients, so it's always a good idea to start off in the low dosage, so the reactivity side is very low, and then we'll work our way up so there's less of a risk.
Okay.
So have you had any reactions with this drug?
Well, I did start with half a pill, like the doctor told me, and I started getting a little bit of an upset stomach, and I was, and it just like it kind of bothered me that I didn't want to eat, it decreased my appetite, and it gave me a little bit of like a bad dream thing, vivid dream, I guess I want to say.
Well, the nausea and abdominal pain is usually the common side effects around there. It usually makes the user of the drug not want to eat, or just have very hot dreams, as we call it, or hot flashes in the middle of the night. And usually this is nothing to worry about, because if it happens with a week or so, then there's nothing too worried about. But if you continue to take the medication and it lasts longer than 2 weeks, then there might be a problem with how the medication is reacting with you, because again, this is a very reactive, so it's best to contact your doctor about this.
Okay.
So one thing I forgot to mention about medication is that you could actually take this with or without food. So if you don't have access to food in the immediate time, then that you usually take the drug, it would be okay. But if you feel like you need to take some food, then it's probably a better idea to take it with food.
I usually eat something in the morning and then take it first thing.
Okay. Do you have any pain in your leg or arms when you take it?
No, I haven't had any.
Well, these are effects. It's a very rare effect, but it could be the side effect of bone fractures. It's nothing really to worry about. It's very rare, and we could catch it quite early because we would see it much more often with the pain in your legs or your arms. But however you start feeling those pain, then you need to contact your doctor, so that we can start working on a replacement for the drug, or possibly drug leveling, so we can understand what might be happening. It might not be the bone fracture, but those are the warning signs for it might happening.
Okay.
And of course, if you always have questions about the drug itself, or you have the side effects, make sure to contact your doctor. But if you have any questions about how to take the drug, you could always contact us here at the office.
Okay.
So do you mind if you repeat back to me how to take it and and what to do just in case side effects do occur.
Sure. You said I didn't have to take food with it, but I do. I just because I don't know, I was in that habit. I take it first thing in the morning, but you said I could take it anytime with or without food, and that I'm doing the right thing right now by taking the whole pill, because I did the half pill and then I went up to the whole pill, and that if I have any side effects continue with nausea or stomach pains or any bone pains, to contact my doctor, and then my doctor can tell me if he's going to change the dosage or the medication.
Okay.
If I have questions about the drug, to ask you.
Yeah. So you could always contact us if you have any questions, and make sure that you're watching those side effects and making sure that you're catching how long they last, so then we can catch the possible long-lasting effects early.
Okay.
Okay. Well, thank
Thank
you for
you.
coming in.
Thank you very much.